I think a lot of people don't necessarily never heard the word, have not understood what it is. So let's talk about what is vaginismus and why does it happen. Yeah, let's start with that.
In simple terms, vaginismus or vaginismus, whichever way you want to say, it just means difficulty or like totally it's impossible. It's either difficult or it's totally impossible to allow any kind of vaginal penetration, even though this woman really wants to do it. So this penetration could be with her partner's penis during the sexual act. This could be a gynaec's finger, a transvaginal probe. It could be a tampon, a cup, whatever it is, right? Just nothing enters the vagina. If at all it enters, it may be just 1 centimeter, 1 inch, but then it feels like a wall. People characteristically say that the moment we start going in, it just feels like there is no hole. It feels like it's hitting a wall, right? And this is in spite of the fact that she really wants to do it. When we want to do something, our body cooperates, right? If you want to lift a pen, your body will lift the pen for you. Now, this is the only space wherein she wants to do it. She very, very much wants to do it, but her body is saying no. Okay. So what actually happens is if this is your vaginal opening, it actually looks really small. And that is why some people think that this condition is happening because of a small hole. Now, visually, it might look small, okay? But it is like a scrunchie. It can actually expand to 9 centimeters to deliver a baby's head. And
Yeah.
penis is only around 3.6 centimeters wide when it is erect. So the space is never an issue. And the hymen also is not an issue because your hymen most of the times is lost by the time we come into our first intercourse. It stretches away and it wears away over time. However, if it is even present, it again during intercourse it will just stretch and it will be gone in a few attempts, right? So your hymen can also not be a reason for this happening. What happens is if these are the muscles around the vagina, there is no bone here. So your vaginal muscles actually shut down. Instead of opening up, they will actually contract and shut down, and it will actually look like a wall. It will actually feel like there is no hole here, right? And this is vaginismus. And this is very perplexing because the woman really wants it. A part of her body saying, yes, yes, I want it. But another part of her body saying, no, no, don't do it. So the bigger part of her mind, which is the subconscious mind, it says, don't do it. It's not safe. We know from the past it's not safe. And so the muscles open to the subconscious mind and shut down, making any kind of penetration impossible. Now, this is vaginismus.
Yeah. And so what could be the cause? Like what are some of the known causes, and how common is it? What are the statistics that you know surrounding? Like how common is it in women?
So the best part about vaginismus is that nobody knows how common is it. It is because it is about sexual penetration. Who is going to talk about it? Who is going to go and report in the register that, hey, I had vaginismus or I have it, right? And so we don't accurately know, what happens inside bedrooms. And so the details are not clear. However, in literature, which is written, the articles are mostly written by foreign countries and they quote somewhere around 10 to 15%. However, it has also been known that in conservative countries, the rates could be much higher. And from my experience, I seem to feel, I don't know, it could be as high as maybe 25% or 30%, right? Some kind of sexual pain is very common, and that's why it's normalized in the country. So that's the first thing.
And it is so common. We see it as a part of pregnancy and childbirth. That's the first time. That's the first contact a woman has with a care provider, and they don't even talk about it until we have a safe space. They might open up, and sometimes, because in a practice like ours, we don't have a routine habit of inserting our fingers, or we don't do a vaginal exam essentially unless there is something coming up. The first time they might be actually faced with is actually during birth, and that can be quite scary. So I would ascribe somewhere around the 25 to 30% in my smaller population that I see. I would say that's fairly good number as I would think. So what are the causes that that have been identified.
Yes. So the first thing to remember is vaginismus is not a physical or organic condition. There is nothing about the vagina that has gone wrong. If you go for a preliminary gynec exam, your gynec will say everything is normal. And when she says everything is normal, it increases the confusion because now everything is normal and still I'm not able to do it. And that often puts the entire blame on the woman. See, everything is normal and you're still not doing it. You are very weak. You really don't want to do it. You're just not trying hard enough. Or you are such a weakling, you can't take pain, right? So it is very perplexing to a woman when she's told everything is normal, it's all in your head, right? So let us understand, why does vaginismus occur. Now for this we have to understand, how does our body always protect us. Now if I were to throw some dust at your eyes, what will happen to your eyes? Your eyes will shut down, right? And that's a reflex reaction. Are you doing it? No, you can't even think that it's happening. Before it comes, like you could think about it, your eyes are shut. So this is a very reflex, spontaneous response that your body throws to protect you, right? Or your hand touches something hot, your hand withdraws. Everything is a subconscious reflex. Similarly, when anything comes close near the vaginal opening, your vaginal opening shuts as a reflex response. Just as your eyes shut or your hands withdrew from that hot thing, your body believes that this act of penetration is threatening, unsafe, dangerous, don't do it, right? And that's why your vaginal muscles simply get a signal from the subconscious mind. Stop, 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 close the door, close the door. And that is exactly what happens. So the root of vaginismus is in fact our subconscious mind. Okay, the root is there. However, it manifests in the form of tightening or closure of the vagina. Now, why is it that your mind is saying no? That's the entire question here. Why does the mind say no? The mind says no because it has evidence from the past. It has a lot of evidence from the growing up years that something about this whole act is not okay. As long as foreplay was going on, she was enjoying it. But the moment penetration starts, the subconscious screams no. Now, in our experience of the last 4 years of running this online 2-month Vaginismus program, we've understood that following our few of the main reasons women get vaginismus in our country. Now, it could be one of these causes or a combination of these causes. The first and the most important cause is the narrative that first night hurts, right? And the girl has either heard this from some friend, some cousin, some auntie, or even in a movie or in a fiction book. That first night is going to hurt and it's going to bleed. Now, if that is the narrative that is fed to her, how on earth will her body allow her to penetrate when it's going to hurt and bleed? The second narrative around this is sex is shameful. So sex is painful and sex is shameful. In our country where sex is such a big, it's an irony. We have the largest population in the world now and sex is just behind closed doors, right? Nobody talks about it. And you are expected to be 100% asexual till the day of your marriage ceremony. And suddenly, overnight, you have to turn into a sexual goddess and have a baby in the first year of life. How is that ever going to happen? If for 30 years, this mind has been fed wrong, wrong, shame, wrong, even touching your genitals, little children, when they touch their genitals, shame, shame, don't touch there. Or masturbation coughed upon. So when something is so wrong for so many years, it cannot become right just overnight. So sex is shameful, sex is painful. The third reason could be back touch. Now, back touch could be of any severity. It could be also a back touch just in a bus, right? And it could be something more severe than that. So something that has happened to her or something she has witnessed. Witness means either she has read about it, she's seen something happening, or she's heard about it. Like, for example, when the Nirbhaya case happened in 2012, there were an entire generation of women between 10 and 25 years of age who had never ever been taught about pleasure-based sex education. They had zero idea of what sex is. And now, 24/7, they heard those details of the case. I am not at all saying that or trying to say that that should not have been covered. In fact, she got justice because she was covered, the news was covered that way. However, what's happened is a lopsided coverage, which means there is 150% coverage of news of sexual abuse. However,
Yes.
the news of positive sexuality or positive sex education, pleasure-based sex education is minus 50 in our country. So this lopsidedness is what recorded in the minds of these girls. Penetration, dangerous, dangerous, not safe, not safe. There was actually a girl who told me on the first day of the program that doctor, when I asked her what are the thoughts that come during your first act, she said, really, doctor, the moment it was going to happen, the thought came as, I hope it does not go anywhere else, otherwise my guts can come out.
Oh, oh my goodness.
She said she had absolutely no idea she was so affected by this case. But when I asked her, that is the first thing that came out. Now, what the little mind, when she was 10 years old, she heard that, recorded that, she saw that violent news, but recorded sex is dangerous. There was no adult
Mhm.
around, parents, teachers, no one who gave a new narrative that what you're hearing is violence. Very bad, should not have happened, but that's violence. This is not sex. Sex is not this. Sex is consensual, respectful, mutual, and it protects your boundaries. So that is not sex, right? And she recorded this, and that was number one reason why she had vaginismus, right? Her body was protecting her. So this is the third reason, bad touch, either to you or to somebody else. The fourth reason could be growing up with any extremely painful experience around the genitals. Now, for example, some women have had very, very painful periods in their teenage. That could be sometimes due to endometriosis. Period pain is so normalized. Oh, everyone has it. What's the big deal? And they don't allow you to take any medication because they think it will get habituated. And so many girls grow up with so much pain around that area that, they have a very distant and a very angry relationship with their genitals. You are the cause of all misery in my life. Or your body will always try to protect a painful area of your body with a contraction, right? The second thing could be infections down there, injuries down there. It could be abscesses down there. Any painful experience, even a painful gynecological experience, a vaginal exam can trigger vaginismus. And I'm so sorry to say I'm a gynec myself, but I have seen cases that where vaginismus was triggered by a very harsh and painful vaginal exam, right? The next and second last reason could be news of painful childbirth, right? Or consequences of sex, because sex leads to pregnancy, pregnancy leads to childbirth. So if she heard or saw something very traumatic about childbirth, like a woman screaming away, then her body is likely to record, oh my God, I don't want to go there, so no sex for you, right?
Yeah.
So consequences of sex like STDs, or unsafe abortions, traumatic deliveries, that can keep the body away from even allowing penetration. And last reason is childhood trauma.
Yeah.
Some women have gone through a lot of bullying, hitting, violence in their childhood, which creates a baseline exaggerated sensitivity to pain. And if they had that sensitivity to pain and they hear news that sex is painful on the first night, done. Their body is now going to protect it. So childhood trauma can predispose little girls to vaginismus later in life. So these are the main reasons which are stored in our subconscious mind, which is the 95% part of our mind. It's like a store which sends signals at the moment of penetration and shuts the vagina down.
Yeah, no, I think it's so just I'm kind of processing everything that you're saying, because as a care provider too, we see this. There have been times when in our space we don't have that high table. We have a small table at that level. I sit down, like I'm sitting with her, and we cover her, and then if there is a reason to be doing it, and I have, not kidding you, I have seen that when my gaze goes towards that area, I have seen the contractions happening. Not kidding. Just like you look towards it, and that the woman's feeling this sort of tension, and you can feel those muscles surrounding the vaginal outlet. It's also that we are not even there's no talk about even the part, right? We call everything down there. It starts with just that. There's no naming of the parts. It's no like vagina. What's the vulva? I mean, it's not that you need a degree in anatomy, but at least you should be able to name the part and say, oh, and how many people don't even know that a woman might have 3 orifices. I mean, it's just, there is such, and like it's a blanketed, like you said, the shame around the area, right? And the last thing that really resonated with me was when you talked about the fear, right? We see that fear of childbirth also, not just with the vaginismus, but it's such a common theme that says childbirth is painful. That's what you have heard completely throughout. So you come in and you're like, I want a vaginal birth, but I don't know why I should have it because it's going to be so painful, and all the other things like you're weak, you will not be, this generation is not able to have it, all of those other things. So yeah, I mean, it's incredible, all the things that you talked about. So when you have seen these people.
I'm fascinated when you say, even when you look at it, there is a vaginal contraction. The nervous system of this girl is constantly on a threat mode. Oh, what's going to happen? What's going to happen? And so it's not just a vagina. You will see sometimes she'll lift her buttocks from the bed and she'll totally tense her thighs and cross her thighs like this.
Yep.
It's a whole body reaction. It's not just a reaction of the vagina. Her jaw will tense up, her shoulders will, as if you're ready to fight.
Right.
So her nervous system is ready to fight the penis at that moment.
Yeah. 100%. When we see all of that, and what is she told? If that is the first experience she has had at a OB or gynec's office, she's just told that you just have to relax. I mean, what even does that mean? What even does that mean? You have to just relax. Like, yeah, unless you're going to give a general anesthesia, I don't think she's going to relax.
I agree.
So we have talked about it a little bit. I want to just go ahead and ask you, A, why is this so rarely discussed? And B, you being an OBGYN, how did you come into this? And what made you start this? I mean, it's just such an incredible journey. I know about most parts of it because I've heard you talk before, but I would want the audience to know that journey.
Yeah. So the first thing is, it's very rarely talked about because it's sex. Who's going to talk about sex in India, right? So women don't even tell their parents. The couple just secretly, keeps suffering, silently suffering. And it's rarely talked about because in India, especially if you think about it, a woman's health is equated to reproductive health, right?
Yep.
So reproductive health means menstruation, periods, childbirth, infertility, contraception, right? So when a woman's health itself is reproductive health, then where is sexual health there, right? And if we are talking about sexual health, then we are suddenly talking about STDs, or we are talking about contraception, right? Where is women's sexual pain featuring in this? When you talk about sexual dysfunction, then the number one thing they talk about is impotence or erectile dysfunction. Why are we not talking about women's sexual pain? And one of the reasons, if you think about the sociology of it, is that women traditionally in our country were, their prime identity was childbirth, nourishing, stuff like that. And so how they get there is not that important. They have to get there and become a mother is all that is important, right? So sexual pain is not just missing from our community discussion, but it is also missing from textbooks. It is missing from textbooks of gynecologists, psychiatrists, psychologists, sexologists. In-depth understanding is not given. The biggest irony about vaginismus is that most people will go to a gynac because this is about the vagina, right? Mm-hmm. So people go to a gynac. A gynac has never ever read vaginismus in her study time, right? In her post-graduation. We didn't even have one paragraph on vaginismus in our textbooks, right? So all she's going to do is she's going to try and do a pervaginal exam to check if everything is okay. That is all that she's going to do. And that very often ends up re-traumatizing the woman. because she's scared of this pain, and we are ending up doing that very thing to diagnose her. And she's often shamed because uh, there is sometimes lack of compassion that is shown. Oh, everyone goes through it. What's the big deal? Your husband will leave you. You cannot be such a weakling. So there is so much shaming sometimes that she undergoes that she stops going to healthcare professionals. The second part is it is psychiatrists that actually are taught about vaginismus. They have stuff in their textbooks, but nobody goes to them. So they never end up seeing a patient. So these are people who are supposed to treat, but they don't see patients. And people who are not supposed to treat actually have seen all the patients. And that's exactly why nobody talks about vaginismus. Nobody really treats vaginismus. The number of years that you spend with vaginismus very easily cross 5 years. A couple that so many couples I see have crossed 3 years, 5 years, 10 years, or even 15 years with vaginismus, right? This is the biggest irony about vaginismus. The second thing you said was, asked me was, why did I start working on vaginismus? So you wouldn't believe, I am a gynac married to a psychiatrist. Both got married when we were doing our MDs. And it was a relationship of 7 years prior, right? So it was not like an arranged marriage where I had fear. And guess what? I had vaginismus. I and my partner were really looking towards it because, of this concept of no premarital sex in India. Yeah. But what happened? Contraction, damn. And for the first 3 years, I didn't care about it because I was busy with my residency. But after 3 years, it dawned on me, oh my God, it's been 3 years, your marriage has not been consummative. It just felt like a big label on my forehead. And I started reaching out for help to different professionals. I first met a gynecologist as usual, and she made me undergo literally a forceful vaginal exam. I didn't even ask her to do it, right? And I told her, don't do it. Just see from outside. But she ended up doing it, and she ended up opening her fingers. And she told me, okay, it's done now. I've opened it. And I screamed.
Oh dear.
And 1 year after that, I was so traumatized and never went to a health professional again. So that just tells us that the understanding was that the area is stuck and closed and I have opened it with fingers. That is how flawed the understanding was, right? Or she told me, oh, don't worry. Your husband has to just do it one day and you just have to bear it one day. Right. So such answers where I was shamed, the pain was dismissed. I went to a psychologist. They ended up working with my mental health. They took up all my past trauma, history of 10 years of physical abuse as a child, took it up and started healing, but totally ignoring the vaginal part of it or pelvic floor relaxation part of it. Just ignored. So I healed this, but not vaginismus. Then I went to a psychologist who totally discarded the mental part of it and just kept working and told me, do fingers, do fingers. So different people were saying different things, right? And so I was so confused. I actually went into a state of avoidance after that this is impossible to heal. I am not going to go anywhere now. And I buried myself in other stuff. 4 more years after marriage, total 7 years. My marriage was in a very space because I had become very irritable, snappy, constantly angry because, a deep sense of shame and inadequacy. And it was affecting our marriage, not just because of the sexual issue, but also because of my irritability. And so I finally decided I had to heal myself to prevent any further damage. And I quit work at the peak of my career, sat at home, started researching blogs or some stuff. There was nothing from India in 2015, only stuff from foreign countries. I read through everything, created some sort of a structure for myself, 3.5 weeks. First, painless penetrative intercourse. And
amazing. Oh my goodness. I have goosebumps.
I was so angry, Vijayaji. I was so angry. I was not even happy. I was angry. I was like, this was as easy as swallowing a morsel of food. Do I have to think what I'm doing? It was like that. Then why the hell did I wait for 7 long years to heal? Why couldn't anyone help me? Even though we were in the top medical colleges, both of us, right? And so this desire to do something started, and in 2020 June or something, I and my husband thought of starting a support group on this. So we launched free support group on vaginismus, and using my own process, 5 people healed. with almost
Yeah.
5 to 10 years of vaginismus. And the irony is that there is nothing, like there is no proper treatment protocol written in any textbook. Nobody
Mm.
knows how to do this properly and comprehensively, right? So, yes, I'm not saying people are not treating it. Yes, people are treating it, but they're treating in silos. You know, some people
Yeah.
are just focusing on mental health, some people are just focusing on pelvic floor and dilators. There is no integrated plan for this. So I sat
Correct.
down and created a formula for healing because I was very encouraged by the first support group. And we created a 4-step formula that if anyone just follows these 4 steps, hopefully within 8 to 10 weeks' time, you should heal. And that's when Proactive for Her came along. It was just getting started, telehealth platform for women's health in Bangalore. And we came together, we joined hands, and we started our first 2-month online program on
Mm.
vaginismus, not knowing if it would even go beyond 2 batches. But
Yeah.
I'm right now running the 34th batch. And
How awesome. Congratulations. And also you just crossed your 500, vaginismus, the person who reached the
just last week,
vaginismus. And I, I
just
can't be more happy for all those women, but also for our society that you are doing such enormous work. Like this is a work that is beyond profession. It has to come together with your own, obviously with your own suffering. And I'm so sorry you had to suffer that much before you heal, but you are now a leading light. And I couldn't be more happy that I have anyone who comes to me, and even in childbirth, I'll say, you know what? We'll do what we can now. We have this, we have that, I give them the, and then say post birth, and there are so many women who have healed through birth with us, which I think is incredible. I can't even begin to, like, I can't be in anybody's body to know what they are going through. I can just hold space for them. But then those who haven't, I have referred them to you, and I know of quite a few who have been really, and some of them I think are going through the process right now, but, a few of them who have already healed. So I'm just so thankful that you're here in this space, and I'm so thankful to that you're here in India talking about this this topic that just doesn't get talked about. Yeah, I mean, just incredible. Well done. That's all I can say. And I'm hoping so many more women will come through it and heal through it. And I'm still having goosebumps as I talk about it. So. So, so tell us a little more about the program. Tell us a little more about what you go through in that program. That would be very, very helpful for people who are listening.
I was just saying that I can I'm crying because I'm going through the same. So yeah, Preeti, I hear you, and I just want you to know that 100% you can heal. There is hope. Just come forward and just receive the help that we are ready to give. 500 plus women have healed. You are no different. You can. Right. And I should also say that we have one of our past participants who's joined this live, Vijayaji. And
Yeah, I saw her comment. I'm very, very, very happy. I did see her comment, and she had said, just trust, go in for it. And I'm really, really happy. I can't remember her name, but well done. Congratulations to her as well.
yeah, and she healed, and she's become one of the greatest advocates that I have seen on vaginismus. And that is what we need. We need women to heal and women to speak up about vaginismus, because unless women speak up, nobody's going to take notice, right? So, okay. So now, what are the components of the program? So I was very sure that this program has to be as integrated and comprehensive as possible, because vaginismus healing is actually not just one thing. It is like a jigsaw puzzle. A jigsaw puzzle with literally 6 or 7 components, and we are missing out on the components when we address this generally. So I wanted all the components to come together, and so what I thought was these 6 components have to be there. The number one thing is an individual therapy. So we have 10 coaches in our program who are mostly psychotherapists, but some are also psychiatrists and gynecologists. Now each client gets one coach as a personal coach for the program. So this coach actually focuses on that subconscious mind and opens up the tape recorder of our mind and find out what actually got recorded in our growing up years that is saying no. And systematically, through great processes of trauma healing, we heal these past memories, or these, which I say, songs in our subconscious, right? The second part is group therapy. it's very important for women to see other women who have vaginismus. Otherwise, there is so much shame and isolation around this condition that's the number one reason why people end up avoiding working on this. I myself never saw even one person with vaginismus during my 7 years of suffering. And so I was clear women need to see each other. So we create these batches on weekends where all women sit together and hear each other's stories, right? And we make pairs, we make buddy pairs where they help each other, support each other throughout the program. The third part of healing of this program is the partner support. Partners are also suffering a lot in this condition. It's not just about the woman, because he is in such a conflict that he loves this girl, but then he also wants his sexual life to go well. So he's conflicted about what to do. Should I stay? Should I leave? What should I do? And very often this ends up with a lot of sadness and frustration on both ends. Both of them lose their desire for sex, and they just start living like roommates. So partners also need support. And so we have partner support groups, which are led by my husband, who's a psychiatrist himself. So in that safe space, he helps men ventilate and share their pain, and also helps them understand what is this condition and how can they help their partners. So, that empathy and cooperation really, really helps in that healing. The fourth part of healing is pelvic floor relaxation. So as important as is emotional healing, pelvic floor relaxation, which is pelvic floor is a sheet of muscles around your three organs, bladder, rectum, and vagina, uterus. These are what have become very tight. So we learn pelvic floor relaxation and dilation. These are vaginal trainers that we give women, and it starts tolerating vaginal penetration with the smallest one, and learns to relax her mind and body with this dilator, and slowly goes up to the bigger size. This is called as vaginal training. The last component is pleasure training. It's very important to remember that this is not just about somehow getting through painless intercourse. This is also about pleasure. If women do not work on pleasure, their sexual desires are not really fixed in the program. Women who just focus on, okay, I just want to get pregnant, somehow help me do it. These people will get pregnant, but their sexual lives will not come back on track because the sexual desire has not been addressed. So we also take in detail pleasure sessions. There are women, even doctors actually, who have never masturbated even though they are 33 years old. They have no experience of their own body. How are they supposed to do it with another person? So this is what is also taught. So these are various components of the program that and of course we also have a lot of yogasanas and nervous system relaxation, because mind is also very stressed. Relationship therapy, a lot of women have to go through couple therapy because of the conflicts. They start fighting with each other, and sometimes they are going to end up in divorces. So relationship therapy also becomes a part of the program, and all of this is addressed in a matter of 8 to 10 weeks.
Yeah. That's amazing. I think every part, like you've talked about it, it's that continuity, isn't it? You're building a continuity of, you're building up, you're listening to their story, you're offering them a safe space, you're taking all the parts and then you're bringing it together as a whole and giving the support of a community. I think it's such a beautiful program. Today is the first time I have heard of it also as a whole. Like I've heard you talk about it, but I've not heard the whole. It sounds amazing, and I'm so glad that you're doing it this way. What does in your previous, avatar as an OBGYN, now you're primarily working with this. Did you find that vaginismus has the impact, and how does it impact the ability to have a vaginal birth?
Yeah, that's a very important question, because a lot of women ask me, if I have healed vaginismus, can I undergo a vaginal birth? Or if I'm not healed vaginismus, can I still undergo a vaginal birth? The answer is yes, whichever way. You've healed, you've not healed, you can still undergo a vaginal birth, because your vagina has a natural capacity to expand to 9 centimeters, which it will. It will expand because of the nature's forces working. Whether you have vaginismus or not, it's still going to expand to 9 centimeters and deliver your baby. Women with vaginismus have delivered babies, right? The only thing where we feel scared is vaginal exams.
Correct.
And so a lot vaginal exams or transvaginal ultrasounds, that's when they really struggle. Or sometimes for induction, we have to put some medicine there. So if they they have landed up in pregnancy without having healed vaginismus, it's very important that they collaborate with their doctors or their whatever midwives and have a very collaborative, sensitive approach where there is a lot of reassurance, a lot of lubrication, a lot of breathing and all of that involved in very gentle vaginal exams, and only when required. We should just not be randomly doing it, and these people will undergo vaginal delivery very well. If they've healed vaginismus, then we just have to reassure them you've healed now, nothing to worry. So just communicate with your healthcare provider. You should get through this easily.
Yeah, yeah. And again, my experience is exactly that, and I can just say that if we are really comforting to them and in a space where you don't need to do unnecessary exams. And I've had somebody who birthday before yesterday. She has had 2 pregnancies with me, and I want to have a follow-up question to that as well, because this sort of floats around. But in both of the pregnancies, 0 vaginal exams, 0.
Wow.
Like 0.
Wow.
And she comes and she births the baby. She waits until a while to even get the viability scan done, so that she's like, yep. And she has had both her babies about 22 months apart. So it is possible.
I myself find it very difficult to believe that without vaginal exams, how they delivered. And I mean, this is fascinating to me. Amazing.
Yeah, but so that I just wanted to loop that in, because people hearing this live should not say that that's not possible, because that's a force that's coming out inside out. And what we are talking about, vaginismus, is a force thing going outside to in, right? So I know we are coming up on the hour, and I wanted to ask you a couple more questions. One is there something called a minimal vaginismus? Because these are just terms that float around, and I want to make sure that people who are hearing this also have that. It's a very little vaginismus, or is it, so that would be lovely to get your opinion.
It has severities, and there is actually a grading that is there for vaginismus. It is called as Lemont's grading, right? But I'm not getting into the technicality. Let's just say mild, moderate, and severe, right?
Okay.
So women with mild vaginismus will have mild vaginal contractions, and the fear is not too overwhelming. So generally with reassurance, sometimes they are able to get through partial penetration at least, right? Or sometimes they might even do complete penetration, but it continues to hurt. So they will be able to sometimes penetrate with reassurance, but it hurts. So this might be mild vaginismus. Severe vaginismus is a wall. No matter what you do, it's fully contracted. And I had severe vaginismus, right? So even though we have these varieties, we don't really talk much about it, because women with mild vaginismus can sometimes end up taking more time than women with severe vaginismus, right? So the time taken to heal sometimes is not very much different. So we don't really categorize much in our program. You have vaginismus, that's it. Come, we are going to just go through the whole protocol with you.
Fantastic. Thank you for that. And then the last thing I would want to ask you is, if there is a couple there or a woman there who's listening to you right now and thinks she might have it, or thinks that they have not been able to have a good relationship, how can they reach out to you? And we'll be sharing all the links at the bottom of the, the links to the live. But how can they reach out to you?
Right. The number one thing is I'm on Instagram. So you can find me, Dr. Taru Jindal, and you can message me there, Instagram. The second possibility is I'm running this program with Proactive for Her. So you can just visit their Insta handle, go to their link in bio, and register for the first screening call. We have a first discussion call where we just try to find whether you really have vaginismus or it's something else. If you have vaginismus, we give you info on the program and enroll you into the wait list. Now the wait list is hardly 4 weeks, right? So the maximum time you the maximum time you spend to get into a batch is 4 weeks, or maybe less than that. And then you get enrolled and start the 2-month program with us. If you don't heal by 2 months, don't worry. We have a 1-month follow-up program also. So we continue doing that, right? So we continue to support till you heal, because some women can end up taking 12 to 16 weeks also, depending on how much past trauma they are carrying or how much additional difficulty she has, like relationship problems and all that. Now, this is what I wanted to say. Also, some resources, we have released an ebook on vaginismus today, which will give you in-depth information of not just vaginismus and its causes, but also the program. So you can go at Proactive for Herds link in bio and download that ebook. You can watch some of my YouTube videos on my YouTube channel, Dr. Taru Jindal. Again, a lot of info on vaginismus. And most importantly, I have a podcast where I have interviewed women, some women who healed with us, and their stories are super inspiring to hear them say it. So the podcast is called Vaginismus in India, Stories of Hope and Healing. You can get that on Google, on Spotify, so you can listen to that. Don't worry, there is hope. You just have to apply yourself with commitment. You will get there.
Thank you so much. That's just been such a wonderful conversation, and you have just like opened it up. Like it's like, I want to say you just have made it like as simple as spreading butter on a bread. It's just so beautifully you have explained everything, and I'm hoping that all the audience, they will get a lot out of this, and we will put out all the links. And I'm hoping that I'll be able to put a link out to your book as well, or even put it on our link tree as well, that PDF link, so that more people have access to it.
It's easily downloadable. You can download it and put it up wherever you want. It's fine.
Yeah. So I just want people to have access, because this is it cuts across spectrums, right? It cuts across everything. Like, to me, I would want them to have it wherever they are in their life, whether it's a teenager who thinks who might have it, or whether it's a woman who is 50 years old who has never had the ability. And I think this thing about pleasure that you talked about, it's so important. I just don't think it is something to do with, just finishing a task and being done. It's about that woman's own body, her pleasure, her understanding of it. And it's a similar thing about birth as well, right? We don't talk about birth as a thing that has just happened. You want to experience it, to also the pain and the power, and not having only the pain without having the power, not having only the pain without understanding that there is pleasure at it, right? So I really feel this is such a multi-layered conversation.
Wow.
Dr. Taru, thank you so much for accepting this invite to be in this program. And I'm just absolutely, I have had a wonderful time talking to you, and I hope we will have more conversations surrounding it.
Thanks a lot for being such an advocate of respectful, gentle birthing, and for hosting this topic on your platform. I just want to say that vaginismus is not just fixing your vagina or fixing your mind. It's actually fixing your relationship with yourself and your own past and present, right?
So
and we have to have a whole body or a whole mind or an integrated approach. And thanks a lot for calling me here, ma'am. Today is the World Vaginismus Awareness Day. Lots of best wishes to everyone here. Thank you.
Thank you so much.